Shigella. So there was a similarity, na? Escherichia was also resulting in what? It was resulting in dysentery. Shigella is also going to result in dysentery. So the full Escherichia family, let us do together. When I talk about Shigella, please note, this is also Ella. Yaad hai? This is not going to have any motility, not going to have any sporing, not going to have any capsule, not going to be positive. Sab no, negative. Shigella, Illa is how we had learned. So sab kuch no. And what is its fermentation ability? It is a no lactose fermentation, of course. That is also no. Shigella was all Illa having stuff. Now, if you remember, I just told you Shigella is something that has a small infectivity dose. Shigella is something that has a small infectivity. Do you remember what all examples I just now told you? I'm not repeating again. For your small infectivity dose, we did chota small. Yes, quick revision for you. C, Cryptosporidium. Which other parasite? Entamoeba histolytica. Next one, EHEC, enterohemorrhagic E. coli. S for what you're reading over here, Shigella, and LAM for Giardia lamblia, right? Now let's get going. So let's talk about the different Shigella species that we have. We have Shigella dysenteriae, Shigella flexneri, Shigella boydii, Shigella soni. The world is sleeping and India is very flexible. Okay, what did I say? The world is sleeping, soni, most common in the world, and Indian people are nice and flexible and good-hearted people. So India mein flexneri is very common. Please note, I just told you all of them are what? Non-lactose fermenters. No, illa, non-lactose fermenter. But Shigella soni is going to wake up late. It is going to be a late lactose fermenter. Shigella soni is going to be a late lactose fermenter. Coming to the next, all of them are going to be, I told you, all of them were catalase positive. All of them were catalase positive. However, this Shigella dysenteriae is going to be catalase negative. Similarly, all of them are going to show you mannitol fermentation, but Shigella dysenteriae is not going to show you any mannitol fermentation. So repeating once again, see, सबसे पहले lactose fermentation तो is sorted. All of them Ella, they don't show you lactose fermentation. But Sony wakes up a little late and that is going to show you late lactose fermentation. Rest, remember, all of them are catalase positive and mannitol fermenters. But this Shigella dysenteriae, this has to cause dysentery. Na? This is a little different. This doesn't show any catalase positivity and you can say it is a non-mannitol fermenter. Now, if I ask you what are the toxins for Shigella that we have, so we have something known as these are the exotoxin, and gram-negative organism hai, so it will have the endotoxin also. Endotoxin, how is it released? Just by autolysis. Autolysis it is going to release, and you know endotoxemia is very deadly. It is going to cause a lot of inflammation and ulcers in the intestine. So just by the breakage of the bacteria, autolysis it is going to get released. Whereas when we talk about the exotoxins, we have something known as enterotoxin, which is obviously going to be the intestine wala. Then there is a Shiga toxin. What are these symbols? Enterotoxin. So I have written Shet1 and Shet2. Shigella enterotoxin. Flex, matlab, this is going to be associated with Shigella flexneri. This is associated with Shigella flexneri. And Shiga toxin, I made a poop or a shit feces over here because Shiga toxin is with shit. That is Shigella dysenteriae. This is the one that is going to be associated with it. But I'm sick of telling you the mechanism. Kitni baar ho gaya? Have I taught you the Shiga toxin or the Shiga-like toxin that you had is going to act by decreasing the protein synthesis? And how is it decreasing the protein synthesis? It is doing so by decreasing the 60S ribosomes. So many times we have done this. So this is sorted. So now what I'm actually going to tell you, you must have seen this mechanism of action in your textbook. So what exactly is happening with Shigella? How does it enter? How does it do? The books have a very chota sa diagram. I'm going to make a better diagram. So for example, if this is the intestine over here, and I say that these are the Shiga bacilli that we've had. So these are the Shigella. The first question that you'll ask me is which is the cell which has picked up the Shigella, and that is going to be the M cell. So Shiga toxin or Shigella organism is going to be picked up by the M cells, and after it is picked up by the M cells, it is going to be given to one cell of your body which is known as the macrophage. So it is given to the macrophage, and here you have the Shiga which has been, macrophage is always hungry, na? So macrophage is going to engulf it. But remember, macrophage is deadly, but Shiga is very, very deadly. So Shiga is now gonna break your macrophage. So there is gonna be a rupture of the macrophage that is gonna occur, as a result of which all these Shigella bacteria are now out. What will they do? They are not going to sit quietly. They are now going to enter the next cell. From which route are they entering, guys? If I pick up this intestinal cell, this must be the apical surface. This must be the basolateral surface. This must be the basolateral. So the question comes is that the basolateral route entry or basolateral endocytosis is going to occur. This is the previous year question, that Shigella enters via the basolateral route. So it is going from here and it is coming finally into this cell. So now you will say, what is it going to do over here? So if you look very carefully, see, if you look at the book diagram also, same cheez chal raha hai. Shigella has come in, which cell has picked it up? M cell. After that, where has it gone? It has gone into the macrophage. Macrophage rupture hua, via which route has it come? It has come via the basolateral route, and now if you'll see, it will go from cell to cell, cell to cell, invade karta jayega. So how is it going from cell to cell? Please remember, God has given it something called the IPA and VMA. Dekho, it has to invade. If it has to invade, so that is going to be associated with virulence marker antigen. That is associated with virulence marker antigen. That is one thing. So if you see that this has entered via which route? This has entered via the basolateral route. This is a basolateral endocytosis that has occurred. It's a very famous previous year question. So how can it go in from the backside? Going from the back door entry ho raha hai. So how is that happening? Because God has given it something called VMA and IPA. What is VMA? VMA stands for the famous virulence marker antigen. It is quite virulent. God has given it virulence marker antigen. And what is IPA? God has given it invasive plasmid antigen. God has also given it invasive plasmid antigen. So all invasion wala things it has. It has a virulence marker antigen, it has an invasive plasmid antigen, and thereby it has invaded and come over here. But the rule was it didn't want to come over here. It wanted to go to other cells also. How is it going to go cell to cell? And that is going to occur by actin polymerization. All these one words that I've tried to put into one slide are previous year questions. Can you answer these questions for me? Question 1, Shigella is taken up by what cells? The M cells. Next, by which cell? It is macrophage. When the macrophage ruptures, by which entry does it enter the next cell? Backdoor entry, basolateral. So it's not so easy to enter via backdoor. It has some very important things. It has virulence marker antigen and invasive plasmid antigen. And finally, how is it going to go cell to cell? It is going to go by actin polymerization. And thereby you can see the same diagram in your textbook. You have the cell to cell actin polymerization happening. Okay, so now we come to the disease. Mechanism done. The disease is shigellosis, which has a incubation period of 1 to 4 days, and initially patient doesn't start having blood. Initially it's a kind of a watery diarrhea, and gradually you will realize that this has ended up in dysentery. But what after that? If it is not treated, and most of the cases, even before antibiotics, supportive treatment is also good enough. So when you have dysentery, what are the complications that can happen in the intestine? There can be infection ki wajah se, there can be toxic megacolon, there can be perforation, there can be metabolic complications because patient is having so much of water and fluid and electrolyte loss. These patients can have hypoglycemia, hyponatremia. This can happen with any kind of diarrhea. But what is this? That is Ekiri syndrome. Ekiri syndrome is basically, I have learned E for E. Ekiri syndrome is a kind of an encephalopathy. It is associated with some kind of the brain involvement. So delirium, confusion. So remember, Ekiri syndrome is going to be associated with encephalopathy, and this is a question again in this entire slide. If you ask me what is the question, Ekiri syndrome is associated with shigellosis, encephalopathy, and I have already told you this is associated with hemolytic uremic syndrome. Guys, hemolytic uremic syndrome was caused by two things, enterohemorrhagic E. coli as well as Shigella. These are the two things which are going to cause the hemolytic uremic syndrome. Enterohemorrhagic for hemolytic, and Shigella can also cause it. Via which toxin? I have already taught you that this is very, very important, the Shiga toxin that causes. Now let's move forward. That is there any other complication in the recovery phase, in the post-infectious phase? This is all happening in the infectious phase. In the post-infectious phase, they can have the Retter's syndrome. What is Retter's syndrome? This is something very, very famous. That is going to be conjunctivitis, urethritis, and reactive arthritis. So remember, conjunctivitis, urethritis, and this you studied in medicine. Reactive arthritis, they can also occur because of Retter's syndrome. That will occur in the post-infectious phase. Repeating again, if you have a question, Ekiri is the most expected. So ab kya bacha? Diagnosis karo. For the diagnosis, what sample will you take? Of course, you will be taking the stool sample. And again, I will ask you the INVIC testing treating. So remember one mnemonic, I am very, very shy. What is I am very, very shy? I am shy means only methyl red positivity will be seen in number 1 Shigella and number 2 Yersinia, which I'll be teaching you in a while. So repeating, it is minus, plus, minus, minus. Only methyl red positivity in Shigella and Yersinia. What is the transport media? It is the Sachs buffered glycerol saline. I know it's a little difficult to learn, but we will. Shigella ke liye Sachs buffered glycerol saline, and that is going to be the transport media. So S for S. Now I'm going to tell you something which might sound difficult here, but it's going to ease your life. If they ask you what is the enrichment media, and enrichment media is usually a kind of a broth, you have two, selenite F broth and tetrathionate broth. What did I say? Selenite F broth and tetrathionate broth. And for selective media, you have something known as, I'll tell you the name, XLD, DCA, SS and HE. Ye kya tha? XLD was xylose lysine deoxycholate, then deoxycholate agar is DCA, Salmonella Shigella agar is SS agar, and hectin enteric agar. You're saying, ma'am, Shigella ka baat karte karte, why have you entered into Salmonella? Because please note that whatever enrichment broth and selective media you are studying, we have some sisters in the intestine, the Salmonella Shigella sisters. That is what we call them. I call them Salmonella Shigella sisters because on dono ka enrichment broth is the same, dono ka selective media is the same. Wow, with one slide I have finished off Salmonella and Shigella. So remember, selenite F broth and tetrathionate broth are for both. DCA, XLD, SS and HE, these are also going to be for both. Okay, this is sorted. I told you what is going to be the treatment. Most of the times it's going to be supportive. Yes, if that does not work, you take the help of antibiotics. So the entire family of Escherichiae is done. Now let's move on to the next family, and that is going